COVID-19 hasn't caused the problems in the healthcare system. They were there. It's made the small ones bigger and the big ones gigantic. So many of our rural hospitals in Kansas were already economically on the edge. Obviously, a lot of that has to deal with the fact that we're still a state that hasn't expanded Medicaid. And so many of those rural hospitals are financially just on a razor-thin wire that they're operating.
In rural America, we are not as prepared to handle an outbreak of COVID-19. We have fewer people who are insured, which means fewer people will go get tested if they think they're sick. We have fewer people that can actually survive if they do get sick because we're less healthy. People are not getting preventative care because they don't have health insurance. So many people's health care is tied to employment. So when they lose those jobs, we're talking about a lack of health insurance.
That fear of I'm going to get sick and I'm going to have these high bills that are going to cripple me financially. They're scared to go to the doctor, they're scared to go to the hospital, and they're letting things go that they shouldn't. They're going to stay at home until they're on death's door.
Hey, Linda, this is Greta. One of the women that we have seen here at Thrive, her name is Linda.
All the health problems that I have, I'm one of those people they put in the hallway, because COVID is just a death sentence for someone like me. Maybe it's the small town feeling of security, thinking that everything is okay, but a lot of people do not wear gloves, they don't wear masks. I don't feel like I have an option. If Medicaid passed this year, it would change so many lives. People here in this town are poor. A lot of them work for themselves and cannot afford health care.
The reason that Medicaid is so important is because it is a safety net. And it is supposed to be there for times like right now, when people who would normally never need it because jobs have been cut and they are falling and they need that safety net so that they can bounce. And if they don't bounce, they splat.
As a physician, somebody who is working on the front lines, there's been an outpouring of support for healthcare workers. There's been an outpouring of support for hospitals. We've had people come and write with sidewalk chalk all over sidewalks talking about how heroes work here. And
frankly, we get a lot of credit.
Our essential workers today are mainly our hourly workers. These are people who put themselves at risk every day for very little pay, and most of them do not have health insurance.
How can you feel very essential when you're being told that we can't function without you, right? But you're not so important that we're going to make sure that you have access to health care. You're not quite that essential.
Medicaid expansion is something that the state of Kansas can do right now to protect people against COVID-19. We're talking about a lack of health insurance during a pandemic, which is exactly when you need to make sure you're insured.
Every year that this is delayed, it's that many more individuals who frankly are harmed from a lack of coverage.
We're all human, we all need help. When is it bad enough, I guess, to help? When does it get bad enough that you say, oh, this person needs help? When they're dying, why should it get to that point?